Welcome everybody to our today's webinar. Today we will introduce you to the topic challenges in leading the panel voice demonstration. So today we will speak about what are the challenges in leading a guideline panel online to complete the guideline development process. What communication and steps are needed to formulate guideline recommendations with panels. Next, we will tell about how guideline groups use the GRADE ETD frameworks and evidence profiles in GRADE Pro to develop recommendations. And at the end, we will show how GRADE Pro and the panel voice feature can help you facilitate this process. So we have a huge pleasure to welcome our guest speaker today, Dr. Wojtek Wiercioch. He is a research and guideline methodologist at McMaster GRADE Center and Cochrane's Canada Center in the Department of Health Research Methods, Evidence and Impact at McMaster University. His research focuses on evidence synthesis, guideline development methodology, and the guideline development process. His main research activities include the development of guidelines and systematic reviews in collaboration with various medical professional societies, healthcare organizations, and ministries of health, as well as the development and evaluation of guideline methods. Next of all, we have Justyna Lityńska from GRADE Pro team. She is a product manager at Evidence Prime, and she provides support to users of GRADE Pro and takes part in the constant improvement of its features. And we have also Bart Vito with us, who is head of product development at Evidence Prime, and he provides the pioneers of evidence-based medicine and the GRADE method with new solutions, and he leads the process of creating new tools that facilitate the guideline development process. So welcome everybody, and Wojtek, the floor is yours.
Great, thank you so much for the introduction, Claudia. And welcome everyone, great to have you here at the webinar. Looking forward to a lively discussion with you all on facilitating guideline panels in their work online, and specifically how GRADE Pro and the panel voice feature can help you facilitate the process. And I'll share my screen to start with a short presentation. And to start, I just would like to provide my disclosure. So as Claudia mentioned, I'm a guideline methodologist at the McMaster GRADE Center and the Michael G. DeGroote Cochrane Canada Center. I don't have any direct or indirect financial conflicts in relation to the content of this presentation. And I present to you as a user of GRADE Pro and a guideline methodologist, but I am not affiliated otherwise with the group in terms of working with Evidence Prime. We'll start with a short overview of the guideline development process and the role of the panel in the decision-making steps. And we have here a figure of the overall guideline development process, and the guideline panel is linked to specific steps in the process, including prioritization of the guideline topic and the questions that are addressed within the guideline, reviewing the research evidence that is synthesized to address that specific guideline question, as well as judging the quality or certainty of that body of evidence. And lastly, here, the panel is specifically linked to developing recommendations and determining their strength, as well as wording of recommendations. And in today's presentation, we'll focus on the specific step of developing recommendations and working with panels online to facilitate this decision-making process. What's important as well to consider is that during all of these steps, there's conflict of interest considerations and management of potential conflicts of interest within the guideline panel when it comes to formulating recommendations. And in terms of using the GRADE approach to formulate guideline recommendations, we use what we call GRADE evidence decision frameworks. These outline all of the criteria that bear on the strength and direction of a recommendation, including the priority of the problem, the size of the desirable and undesirable effects of a specific intervention or management option that the guideline recommendation will address, the certainty of the evidence, patients' values, resource use, impact on health equity, and acceptability and feasibility of the interventions or management options. In terms of panels' decision-making, panels are required to make judgments for each of these criteria to formulate the recommendations. This means that they need to consider and weigh the balance of the priority of the problem, as I mentioned, that value that patients place on the outcomes, consideration of the costs, feasibility, acceptability, and impact on health equity. And depending on the balance and judgments about these specific criteria, the panel decides for or against a specific intervention or management option and decides on the strength of that recommendation, whether it's going to be conditional, or in other words, weak, or whether it's going to be a strong recommendation. So that gives you an overview of the general process that panels are involved in for making recommendations using GRADE and the GRADE evidence decision frameworks. To briefly introduce panel voice, and we'll have a demonstration of the feature later by the team at Evidence Prime. The feature in GRADE Pro allows for online review of the evidence decision frameworks, including those evidence decision criteria that I had just introduced, the summary of findings tables that synthesize the research evidence for the desirable and undesirable effects of a specific intervention or management option or diagnostic test option, for example, and the final recommendations and wording of the recommendations that the panel will decide on. In terms of the panel voice feature, this is set up as a survey for individual panelists to be able to comment, vote on specific judgments, or agree and disagree with judgments for the guideline questions that they're working on for the guideline. And for example, here you see a screenshot of which you'll see more of what looks like this survey page that a panelist receives through an email link, and they have a listing of the questions requesting their input, which could be, for example, providing a vote on a specific criterion or all of the criteria, providing comments on the content presented in the evidence decision framework, or agreeing or disagreeing with specific judgments. And when it comes to facilitating guideline panels to formulate recommendations, and in particular, working with guideline panels online, a few options are available. There, for example, could be one guideline panel that we're working with for decision-making, or there may be a central guideline development group for drafting of recommendations and ETD frameworks, and a panel for final decision-making, so a two-step process with two groups involved. We also have options for having in-person meetings, and over the past several years, most guideline panel meetings have taken place in the virtual space, having virtual meetings and teleconferences, as well as online work for completing evidence decision frameworks, drafting materials, drafting evidence syntheses, etc. And the process to formulate recommendations involves panel discussion, reaching a consensus, and voting where needed. And the panel itself goes through the considerations around the ETD criteria and formulates a recommendation to be published in the guideline. And in today's webinar, we wanted to highlight a few challenges that occur in leading the guideline panel online specifically. And one of the challenges that has come up in terms of leading guideline panels to online work and having virtual meetings and teleconferences is availability of panel members. So facilitating online participation from all responsible or all voting panel members that is needed to complete recommendations. There is preparation work needed for the panel discussion and consensus. And there is a need to seek final consensus and agreement on the recommendations and communicate them to the entire panel or all those responsible for formulating the recommendations on the panel. And typically with online work and online meetings, as opposed to, for example, scheduling and having a 2-day-long meeting for a panel to meet in person and work through, for example, 10 to 15 or to 20 guideline questions and formulate recommendations. Typically, online meetings will be in shorter format, spread over multiple days and multiple weeks, for example. So we have a limited time to formulate all the recommendations. And we'll go through each of these challenges in detail and see how using the panel voice feature and online work through GradePro, from my experience, has helped in facilitating the online participation of the panel. So I've mentioned that there may be difficulty in getting all 10 to 15 or however many panel members are on your panel to join online meetings over multiple teleconferences or consensus meetings. Ideally, we want all panel members to be present during all discussions and all consensus discussions or voting on recommendations, but that's not necessarily the case, and it's challenging to have everyone on for all available times. So a potential solution to this, using the GRADE evidence decision frameworks as well as the panel voice feature, is to send the draft and completed evidence decision frameworks with the individual summary of findings tables summarizing the research evidence to all of the panelists individually to collect their input and comments on material prior to any meetings taking place. So this facilitation of the online work helps all voting panel members or those who are participating in formulating recommendations to actually provide and give input without having to be there in the meeting itself, or especially if they're not going to be able to join a meeting, that they provide input and comments on the material in advance online. And how we can accomplish this through the panel voice survey is to send an evidence, sorry about that, is to send an panel voice survey for comments to finalize material. All of the comments will get collected centrally through the GradePro application, and then the methodologists or chairs of the panel can review the material and work with the guideline development team to finalize the frameworks in preparation for discussion. So going on to the second challenge of preparing for the panel discussions and consensus, we need to ensure that input is provided from all voting panel members. So for example, while managing conflicts of interest and any recusal rules that are implemented to ensure that panel members with potential conflicts of interest are not providing input or influence on the recommendations from which they should be recused. And we want to ensure that there's optimal use of the available discussion time to reach consensus on the ETD judgments and recommendations within those limited times we have for virtual meetings. And in terms of a proposed solution, what we can do is send the evidence decision frameworks to individual panelists to now collect a pre-vote on the ETD judgments. So we've completed a step of reviewing the content, providing comments, and finalizing it with input from all individuals from the panel. And now a final or completed draft evidence decision framework gets sent for a pre-vote on all the individual judgments from all panel members. What we can then do is review the votes for the judgments that came from the individual panel members in advance to plan the consensus discussion. For example, focusing on the specific criteria that need more time for discussion and consensus versus those where there was general agreement in the pre-voting, and we may need to spend less time on those. In terms of challenge number 3, we need to seek consensus and agreement on the recommendations. So we would have a online or virtual meeting to discuss the ETD criteria and make judgments, taking into consideration any pre-votes that have been submitted. And what we want to do is to get an agreement on recommendations that were drafted during that meeting, including the final wording. So what we want to do is obtain sign-off from the entire panel to communicate the final recommendations. What may take place is that during the discussion, the panel reaches consensus on a certain direction and strength of the recommendation, but there may be a need for some edits to the wording that, for example, the panel chair or chairs would look after, and then they would send the completed now evidence decision framework with the recommendation inserted with the final wording to the individual panelists for their agreement. And this accomplishes that all panel members see the final recommendation in the format in which it will appear in the guideline, and they could submit through the panel voice survey an agreement vote on the recommendations. So now, in terms of working with the panel online, they would have completed some online work through panel voice to review the ETD drafts, to comment and provide input on them, to pre-vote on them in preparation for an online meeting and discussion, and then to agree on all the recommendations. In addition to this, there may not be time to complete the consensus or formulate recommendations for all guideline questions. For example, if we have set a 2-hour panel meeting and we try to complete 3 recommendations, but we get through only 2 or 2.5, online work may be needed to finish the ETD voting and recommendation, or to address an entire guideline question for which we didn't have time to discuss in the meeting. And again, here, panel voice provides a potential solution in which we can send, if it's for a question that we haven't addressed yet, send a blank prepared evidence decision framework, again, for the voting, then for agreement to complete the work online through the panel voice survey. As well, we can then send the completed ETD with the recommendation and send it for agreement in a second round. So this is sent as panel voice surveys for the initial judgments from all panel members, then in the second round for consensus and an agreement vote on the individual judgments, as well as a recommendation. So the panel voice feature and the process of working with the panel online could be used to address an entire guideline question, and then it could be decided whether, based on ability to reach consensus through the online work, whether a follow-up discussion may be needed with the panel. And I see there's one question in the QA, question and answer field, which I'll address now. And it is, how do you, Anitra, sorry, asks, how do you mitigate COI? Is there a formal process defined? So we'll show shortly in the demo that given the organization's conflict of interest management policy, it may be that, for example, the organization requires that no members of the panel have any conflicts of interest in order to participate. So in that case, there is no conflict of interest management needed at the stage of formulating a recommendation. It's done at the time of forming the panel and recruiting and involving only those that don't have any conflict of interest. Now, the reality is that panel members will often have some sort of conflict of interest due to relations with, for example, industry or companies that may be affected by the interventions, but this may be only for specific guideline questions. So for example, out of 15 questions being addressed, a panel member may have a conflict relating to 1 or 2 of them. And in those cases, what organizations may typically do is ask panel members to recuse themselves from providing voting and judgments on that specific recommendations. And through use of the panel voice surveys, this is something that can be done to send the questions for input as well as pre-voting or agreement votes only to the panel members who are marked as not having a conflict for that specific question. So that would be the formal process that we use using the panel voice survey specifically. I hope that helps to answer the question. So given the presentation of these challenges and potential solutions, I'll present a case example and switch over to Grade Pro to show how the panel voice feature was used for a guideline that we worked on here at the McMaster Grade Center, which was recently published in December for the European Society of Thoracic Surgeons and the American Association for Thoracic Surgery, a guideline for the prevention of cancer-associated venous thromboembolism in thoracic surgery. Now, for this guideline effort, we had met with the panel once at the beginning of the process in person to resolve the prioritization of the guideline questions and topics that will be addressed. But then the remainder of the work, including preparing the evidence syntheses, having panel meetings, all took place online. So we had our panel teleconferences regularly scheduled every 2 weeks or so, to have 1 to 2 hours of discussion time, through which we worked through approximately 20 plus recommendations. And for all these questions, we had used the panel voice feature extensively, and I'll switch over to show how that looked. Grade Pro. So in this specific guideline, we had a number of questions, interventions for prevention of venous thromboembolism in different types of thoracic surgeries, including lung resection, pneumonectomy, and esophagectomy. And we had the total of 24 questions and recommendations. And you see here, this is what the panel voice feature looks like. Justina and the team will give a bit more of a demo after this, but what I want to demonstrate is how this worked in practice in terms of obtaining panel input. So you see here the ability to send the survey for individual questions, to send reminders as well for the specific stages of the formulation of the recommendations, including the assessment of the individual ETD criteria, formulating the recommendation, and the conclusion with agreement on the final recommendation. So when we sent the surveys to the panel, what we had is for each of the questions, sending of the survey for the pre-vote prior to the panel teleconference, for us to be able to collect judgments from all individual panel members, to be able to, one, facilitate the discussion, to address that challenge of having limited time and being able to focus the discussion. And here, for example, you see for the domain on undesirable effects, the panel needed to make a judgment. In the voting here, we had quite a bit of a split, with 3 of the panels voting for a moderate judgment, 4 voting for a judgment of small, 3 voting for a judgment of trivial. And seeing this information and pre-voting ahead of the consensus teleconference allowed us to know that we should focus on this specific criterion more, to discuss why there was a difference, for example, in the pre-voting, why some panel members thought the effects were moderate, others thought they were trivial. Whereas, for example, if we go to one of the criteria, such as the acceptability or feasibility of the intervention, we see that majority answered probably yes or yes, and likewise for feasibility, probably yes or yes. So this domain or criterion for the ETD would require less discussion, but perhaps we would focus on whether the judgment should be probably, given there's some uncertainty about the answer or the vote here, or an outright yes. But again, there's not as much of a split in the voting. In addition to the pre-voting, as you saw here, we also completed questions in full for the full process of agreement on the recommendations. And here you see the options are set as agree or disagree. So for the final round of first sending the ETD for comments, then sending the ETD for a pre-vote, and then selecting based on the pre-vote the majority of the answer, for example, we would look to see whether there's agreement or disagreement with the judgments. And for example, we would have here majority had agreed, and again, we would be able to still have a follow. In this case, we did have a follow-up meeting because there were some judgments that we asked for individually that we needed to confirm with the panel. So the other aspect that this shows is you can have a mix of agreement votes or votes for individual judgments that you want to seek from the panel for the specific questions. Whereas here, the majority of the other criteria were set as agree or disagree. So in this case, we were able to complete most of the work for this guideline question online and only meet to finalize the judgments, which were given here in the summary, and with which the panel was asked to agree or disagree. And you see that majority of them have agreement, and we only met then to also determine the direction and strength of the recommendation with a pre-vote for this done ahead of time. But you see as well here, there's a bit of a split in terms of the possible options selected, whether it should be a strong recommendation for or against. And this was actually one recommendation that required quite a bit of discussion because the balance of the benefits and the harms, or desirable and undesirable effects, was quite close. And the panel was able to have this information, including the chairs of the panel, to have this information ahead of time to be able to facilitate the discussion. So here we were able to skip over most of the criteria for which there was agreement, discuss the balance of the benefits and the harms, and then focus on what should the recommendation be. So you see here across all of the questions, we had these completed in different stages, being able to obtain panel input, agreement on specific judgments, and then consensus for the recommendations. And with that, we'll have a demo of the tool itself so that you can see specifically how it's actually set up to obtain input from the panel members and how the survey is sent. And then in the end, we'll also have more time for a Q&A, and we'll look for your questions in the Q&A section in Zoom. And I'm happy to answer any of them through text or later on when we have time towards the end. And I'll hand it over to Claudia and Justina.
Yes, thank you, Wojtek, for a great presentation and for showing us the example of the process. And we will also post the link in the chat for those who are interested in reading in seeing the results of your work. And Justina, the floor is yours.
Thank you very much, Claudia, and thanks again, Wojtek, for your interesting presentation as well. So now that we have heard so much about the practical issues that one can encounter when developing recommendations, so let's hear more about how these can be solved. And I think the theme that connected all of the 4 issues that Wojtek mentioned is an issue that we all are even a bit too much familiar with, which is lack of time, right? Everyone always is missing those few hours in a day. So this is where Pavel Voice steps in and makes sure that everything goes as smoothly and as quickly as possible. And this is done through a number of ways. First of all, Panel Voice is automating whatever could be automated in a way that once you have evidence decision framework table that Wojtek described completed with the evidence, you no longer have to worry about copying and pasting anything manually. The service will be created automatically from what you already completed in GradePro. Another thing that is being facilitated is the conflicts of interest management that Wojtek mentioned. So you can use GradePro to send COI service to your panel members, and once they complete them and you discover that someone has some conflict of interest, they were employed by a manufacturer of a drug, for example, you can mark it, and you can mark this for just particular questions. So if someone is conflicted only for one guideline question, then this will be marked. And then you no longer have to remember about it yourself. When you are sending these questions, you don't have to think every time, who was conflicted for that particular question. This will be excluded automatically by GradePro. And most importantly, when Panel Voice is used, it keeps everything in one place. You have a single screen, a single dashboard, where you see all questions, all guideline questions in the document. You see their status, whether they were sent already or not. You see who responded, how many people responded, and as Wojtek mentioned, you can also send reminders because, well, one of the results of the lack of time is that we don't always have time to respond to the emails of people who are asking us questions. So you can always remind them that you are waiting still for them to answer and that they should visit the survey and provide their judgments. I will now show you briefly how Panel Voice is sent, and in the meantime, I will be drawing your attention to the issues that Wojtek was mentioning and how the features of Panel Voice can answer those issues. So when you send it, you are first asked which parts of ETD you want to send. So as Wojtek mentioned, there are 3 parts: the 12 criteria of the ETD, the assessment, the recommendation, and the final conclusions and the text of recommendation. Wojtek mentioned pre-voting, right? So when you want to just get the initial idea on the panel's opinions before the meeting, so you know which criteria you will have to focus on and spend more time on to discuss, and which you can just go through easily because everyone has roughly the same idea. So then you can just send the assessment part. There's no need to send everything. You just send the 12 criteria, and that's what the panel members receive. They receive only the first part, and they see the criteria, they see the evidence, they provide their answers, and then they submit the form to you so you can receive it. However, as Wojtek mentioned, there can be cases when, for example, you had no time during the meeting to discuss everything, or someone couldn't simply come and they have to provide their answers outside of the meeting on everything, not just the 12 criteria. So then you can send everything. And when that happens, the panelist receives the full survey. And apart from the 12 criteria that I mentioned, and we'll now scroll through quickly, sorry for that, that's a lot of data, they also receive part where they can decide on the strength of recommendation, on the direction. They can provide their comments, of course, at every step of the way, and they can suggest their idea on the text of recommendation and additional considerations behind it. So this is what happens when you send them the full survey, the full ETD. Wojtek also mentioned about people not always being able to agree on a particular items. So, for example, it may happen that you send the survey to the panel members and they provide an answers, and in some cases they are roughly the same or even 100% the same. In some cases it may happen that they will be differing, that some people will have differing opinions, and you want them to reach the final conclusion. In that case, when you are sending the panel voice survey, you can use the pre-selected judgments option. It means that instead of being able to provide any answer they wish in the form, instead of being able to mark whether it's just yes or probably yes or perhaps they don't know, they will have it narrowed down. They will see the options you suggest as the panel manager, and they will only be able to say whether they agree or disagree. So this can be used to finalize the answers, that you have it plainly stated that people agree with the final judgments, or they can disagree if it's still an ongoing discussion. And what's interesting is that once they disagree, the comment becomes compulsory. They are compelled to provide the reason for their disagreement so that everything can go more smoothly next. So you can decide which part to send and whether or not the panel has a full scope of answers to provide, or only agree to the answers that you already suggested. You can send a few questions together to save time again. So instead of doing it manually for each question, you can do it in bulk. You are deciding on the text of the email the panelists are receiving. You can also attach helpful files to them so that once they receive the email and the link to the survey, they also receive some additional information to inform them on their decision. You are also providing your contact address so that they can ask you questions very, very easily. And finally, there is the list of recipients. And as Wojtek mentioned, there can be cases where you send it to everyone because you are just scoping their opinions before the voting. You are doing a pre-voting, or you are voting on a question that there was no time for during the meeting. Perhaps you are missing only answers from a few people, then you can just send it to them and not bother those who already provided their answers. And finally, those who are conflicted with that particular question are excluded. So now I will show you a preview that there was a person that was conflicted with this question, and Panel Voice automatically excluded them from that list. So I didn't have to remember about it as a panel manager. I could just freely mark everyone because I can be sure that if I see them on this list, then they can receive that question. And then it's just apply, and the question is then sent, and you see whether they answered already or not. What's also helpful is that sometimes after sending the panel members with the evidence to decision table and to ask them for their opinions, it may happen that something has to be corrected. For example, someone pointed out a mistake in the numbers and the table has to be updated. When you do that, and let's update this particular table. This particular criterion is highlighted. And then when the panel members receive it for the voting, this is highlighted for them as well. And their previous judgment is removed, and they have to vote on this again because there's new data or corrected data. Everything else that hasn't changed remains the same, and their previous answers remain the same, and they don't have to go through the whole form. They just need to fill in the information that is needed. Finally, another thing that Panel Voice can be useful for is facilitating the meeting during the meeting, and then you can just show the evidence to decision table in GradePro. You can present it via sharing screen or on a projector if it's a live meeting. And as you could see for Wojtek, he didn't have these names here. He had anonymous votings because sometimes, for example, you want to keep the answers anonymous, and GradePro has this option. In the view settings, you can set anonymous voting results, and this way you are hiding the answers of particular people from one another so that they are not influenced by it. You can even hide the voting results altogether so that the discussion, for example, is not prejudiced by the answers, but this is up to you. You have all those options available, and actually many more, because as you could see from Wojtek's presentation, the development of recommendations together with the panel is an quite complex issue, and therefore the feature for supporting it is also quite complex. So if you have any questions, you are more than welcome to ask them in the Q&A section, but also after this webinar, when you are being sent with the recording as a registered participant, you will also receive a description of Panel Voice in detail, a detailed tutorial with all options described and all the features explained. And from my end, for now, this is all.
Thank you, Stina. That was a great demonstration. Thank you. For now, we don't have any questions in Q&A, and I invite everybody to ask if you have any question. And I have one question in the chat. If we disagree with the decision, can we vote multiple times?
I can take it. So yes, Panel Voice was designed in such a way to allow you to, first create and modify this process in the software based on your needs with the real panel. So you can do multiple iterations of the voting, and you can also use different modes of voting. So you can, in the first iteration, you can vote on a full scale, and then, when you trying to reach consensus, you can change this and vote, on the scale yes or no, do you agree or not agree, and reach the final consensus. So, and all of those rounds, all of those iterations, there is a tab with, historical voting. So you have the recording of all your previous votings, all your rounds, who voted how, so you can always return to those results. I hope answered.
Thank you, Bart. Yes, I have another question in the chat. To see major areas of disagreement to focus on, can we start with yes/no voting?
Yes, you can do that.
Yeah, no,
I will leave it to Wojtek how methodologically it works in practice.
Yeah, thanks, Bart. So you can start with a yes or no vote. So one of the ways, there's different ways to achieve the consensus process. So I mentioned there's could be, for example, a one panel that drafts, or one group, that guideline development group, that provides draft recommendations and suggested judgments, which then go to the panel for agreement or disagreement and final decisions about the individual judgments and the recommendation. So you may do more of this preparatory work. And for example, if you're working with one guideline panel, you may ask the select panel members. So one thing we often do is we assign to each guideline question one or two responsible panel members to be the liaisons for that questions. And we may ask them that they provide, for example, their initial judgment for the criteria and possibly for the recommendation. And then we send it to the rest of the panel for that yes or no agreement vote. And then we can see if there's a disagreement on specific judgments or the recommendations from the rest of the panel, we take it to discussion. But otherwise, you may be able to complete the process largely focusing on and starting with suggested judgments and a suggested recommendation, or maybe in round one, just suggested judgments. In a second round, the suggested recommendation. As Justina and Bart mentioned, you can send multiple rounds. And then you look to the panel to see if there's disagreement as a starting point. If there is, you may bring it to discussion. If there isn't, you may finalize the recommendation and then send it off for one more agreement vote to say, this is the complete ETD, everyone agreed on the judgments, and this is our recommendation. The second question on what to do when there is not much evidence, that's more of a, well, so that's one of the, I would say, in relation to using panel voice and getting that online input, in particular, when there is not much evidence for a specific either criterion or for the desirable and undesirable effects or benefits and harms, in other words, for the health outcomes for the intervention that's being addressed. Obtaining input ahead of time may help because those are the areas where more discussion may need to take place with the panel. And the pre-voting helps us to see where the panel stands in terms of a judgment, even when there is little evidence, or for example, very low certainty evidence for the benefits and harms or for one of the other criteria. So to address, what to do when there's not much evidence, we still ask for the voting. We still make judgments about the ETD criteria, but here there may be more panel discussion and relying on the interpretation and experience of the panels and, for example, expert evidence that we collect from the panel to answer the questions. But in addition to those methods, it's really the pre-voting and getting more input with the online preparatory work that really helps when there's not much evidence. Lastly, is there training on creating evidence tables? So do you mean specifically for Grade Pro? So there are various Grade Pro tutorials, including in Grade Pro, on creating the actual evidence tables. And then otherwise for creating the tables and the methods, there's various workshops and webinars from the Grade Working Group that you can look up, or for example, from the Gin McMaster InGuide program that provides training on guideline methodology and creating evidence tables. Hopefully that answers your question.
Yes, thank you, Wojtek. Maybe we can also share some links here. I have one more question. Do panel members need to have Grade Pro accounts?
So I can also take that. So no, we understand that if you are electing someone as a panel member, they could be the domain expert. So for example, in case of of Wojtek's guideline, there could be hematology experts. There can be even patients in the panel, depending on how it's organized. So there can be people who not necessarily need to be trained on guideline development, trained in using GradePro, and even though creating GradePro account takes only 30 seconds, still it's not something you would require of them. So if someone is only to be a panel member, if they are only to provide feedback through the service, then you only need to know their email and name, and you can enter it into the project without them having an account, and they will be sent all the required forms as they are being sent. So it's conflicts of interest forms, it's the panel voice forms, or even other features which were not described today, such as brainstorming questions and outcomes to be addressed in the guideline.
And to add to that, those panel members just get emails with a link which opens this voting form. And Justine showed this in the presentation briefly, such form, how it looks like. This is their personal form in which they can answer, all the votings on all the PICO questions. So they just operate within email and a link to this form that you see at the moment on your screens. They don't have to have any GradePro account, then they don't have to know how to use GradePro. They just provide their expertise for the topic.
Yes, they can even bookmark this link if they want to, so that everything is accessible in one link. But also every time they are sent a question, they receive the link again, just to be reminded.
Okay, we have one more question. Can you import to Grader, so GradePro from Providence? Not yet. We didn't talk to Evidence yet directly about integration. We are integrated with Revman Web at the moment, and probably in the 2 months, so in April, you will see a new webinar about our new functionalities of import evidence from Revman. And it's possible that we will at some point of time in the future have also integration with Covidence.
Thank you. Yes, we received one more question. Do you need a paid account to use these options?
Yes, so Panel Voice is available for guideline groups. So those are for Teams account, for smaller guidelines, or enterprise for organizations.
Yes, you can find all the information also on the website. And we will forward you all the links and email addresses in the email after follow-up email after the webinar. Another question: Revman Web needs Cochrane Archie access to export to GradePro.
Okay, so I can take it. So at the moment, yes, you need to have Cochrane account, but since Revman just allowed their users to use also Revman Web without having Cochrane accounts there. So that's what we are now working on with them. So an ability for users without Cochrane accounts to be able to export data from Revman and upload them to GradePro. And this will be done through files similar to CSV, those files as they are also used now in Cochrane library. So this is coming soon, probably, I guess this functionality will launch in April, and also possibly at the end of April, we'll discuss this on another webinar like this.
Perfect, thank you. You showed another question. You showed the PDF. Can this be created with GradePro?
Yes, every table you create in GradePro, so whether it's evidence table, so summary of findings table, in other words, or the evidence to decision table, which is used for Panel Voice, both of these can be exported to PDF and to other formats, so also HTML, or in some formats even outside links that you can insert in your publications, so you can export it and publish in a number of ways. PDF is one of the most basic ones. I can already see also the question about tutorial for the subscribing users. Yes, whenever. First of all, there's always the support email available for every GradePro user, the support@gradepro.org, and we are always responding to every question. If there is a new group coming and subscribing for, as Bart mentioned, either team or enterprise subscription, there then a separate training can be agreed on. We are also currently in a quite advanced stages of working on expanding our knowledge base and creating separate tutorials. An example of such tutorial in a written form, so as an article, will be sent together with materials of from this webinar. So this will be explanation of Panel Voice, but all other features will also be explained in the future.
Thank you, Stina. There was another question in the chat which Wojtek already answered. Can a summary of voting results be exported?
Yes, if in case someone didn't see this question, then yes, it can be exported.
And another question in the Q&A, if we have few application examples within rehabilitation frameworks, and Harris is asking to provide a link.
So for me, unfortunately, I don't have any examples for rehabilitation guidelines, but one thing I'll mention, another GradePro product, is the database of evidence decision frameworks and recommendations. Maybe you can provide a link in the chat. We'll have recommendations and evidence decision tables that are posted by other groups, and you can search there. I'm not familiar with any. I'm not sure you'll find any on the databases, because it's more of a less commonly explored area in guidelines. But if anyone else has an example from attendees about rehabilitation guidelines, feel free to send it to us in the chat, and then we'll share it.
Yes, so to add to that, well, as the GradePro team, and more specifically GradePro support team, we are always more than happy to provide help with using GradePro as a tool itself. However, when you are speaking about very precise examples of very precise use of these particular tools, then it depends usually whether we have cooperated with such team in the past, and if we are ourselves familiar, because, well, no one is an expert on everything, and that's why we are always in close contact with specialists such as Wojtek, who can provide the methodological answers to our questions.
Okay, so let me just show you our social media handles. And as already Bart mentioned, the next month, or in 2 months, next month, we will have a webinar focusing on our other tool, Laser AI. And in 2 months, we will have a next GradePro webinar. So subscribe to our newsletter and follow us on social media not to miss it. And thank you to all the presenters. Thank you a lot for your time to prepare and to show us these examples. Thank you.
Thank you all. Thanks so much.
Thank you.
Thank you very much. Thank you all participants for being here.
Thank you.